Breaking tonight, Harris County Judge Lena Hidalgo just announced the county attorney will file a lawsuit challenging Governor Abbott's executive order that bans local governments from enforcing mask mandates. She went on to commend everyone, including superintendents, for taking steps to protect the community.
Tonight, Spring ISD became the latest school district in Texas, following Dallas and Austin, to announce a mask mandate for all students, staff, and visitors. Now, all of this as the Delta variant spreads like wildfire. So many people are ending up in the hospital with COVID that hospital capacity in our area is reaching the worst crisis level we've seen since the beginning of the pandemic.
Let's take a second to put this into perspective for you. The state of Texas is divided into what's called trauma service areas. Our TSA is Q and is made up of these 9 counties, including Harris County. Trauma Service Area Q serves more than 6.6 million people. And as of today, there are only 27 ICU beds available at hospitals across the region.
Let that sink in for you, folks. 27 ICU beds for more than 6.6 million people, according to the Texas Department of Health. Hospitals are able to add more ICU beds if needed, but another big concern is whether they have enough doctors and nurses to tend to them. And this evening, in fact, just tonight, St. Luke's Health announced a temporary closure of its emergency room at their hospital in Conroe due to rising capacity and critical staffing shortages. They're moving all urgent hospital operations to their hospitals in the Woodlands.
And that's where we find our Matt Doherty, who's taking a look at the bigger picture tonight. Matt.
Montgomery County officials took a tour of the inside of the hospitals to see what's happening for themselves. What they found is alarming.
We went to St. Luke's, we went to Herman, we went to Methodist across I-45. We talked to the people over at Children's Hospital.
Montgomery County Judge Mark Keogh describes witnessing a crisis filled by the Delta surge.
So then they took me on a tour, and I walked down the halls, and I'm not exaggerating. I saw people in beds in the hallway with oxygen. I went through the emergency room, and we saw in one place they had 90 people they were trying to get in there and only can hold 20. So they had them and had converted closets, waiting rooms, all these various things. I've never seen anything like it.
Outside of the hospitals, more patients and ambulances waiting for a spot to open so they can get inside.
They end up sitting inside the ambulance for 3, 4, sometimes even 5 hours.
The Texas Department of State Health Services reported today there are only 27 ICU beds left for the 9 counties in the greater Houston area region. That said, the Texas Medical Center says some hospitals have been able to create more ICU bed space by delaying procedures and converting their surgical rooms. Yesterday, tents were erected outside of LBJ Hospital in Houston as a future triage for patients who show up to the ER. The rapid spread of the Delta variant, coupled with a severe shortage of nurses throughout the state, has led to a situation that's become unmanageable.
It spreads much quicker. We're finding people in the hospital now that are in their 30s up to 50-year-old in these crisis situations.
In the Woodlands, I'm Matt Doherty, KHOU 11 News.